Welcome to Black Women's Health, a podcast, a platform promoting health and healing for Black women. I'm Dr. Rahman, and I'm a board-certified OBGYN. 2 weeks ago, we spoke about internal reproductive organs, the ovaries, which are the powerhouse which store and mature our eggs that produce the essential hormones, the number one being estrogen. The fallopian tubes, the bridge where the sperm and egg meet up. Sperm swims from the vagina into the uterus, away from the uterus, into the fallopian tube to meet the egg. And then the fertilized egg will reverse direction and travel back to the uterus, which has been primed and ready for the growing fetus. The uterus, a specialized muscle that can accommodate a growing pregnancy, and then at a designated time, contract and expel. Contract so that the opening of the uterus, the cervix, will then open to allow the fetus to travel through the birth canal, the vagina, into the world. When you stop and think about it, all of it is freaking amazing. Last week, we talked about the external female parts, like the clitoris, the inner and outer lips, which are respectively called labia minora and labia majora. The urethra, where urine exits from, and its relative position to the vagina. The perineum. You were encouraged to do the vulvar challenge because too many of us don't look. Too many of us don't know our anatomy. And for too long, admittedly, medical textbooks didn't identify organs such as the clitoris, not giving it any importance. And yet I say, ask any grown woman, how important is your clitoris? Today I wanted to talk about another structure that often gets ignored until there is a problem, and that is what we call the pelvic floor. It is composed of the levator ani and coccygeus muscles, which form a platform to support and uplift not only the uterus, but the bladder and the rectum. If these muscles, levator ani and coccygeus, are stretched out, for instance, as a result of a vaginal delivery, or weakened as a result of aging or estrogen deficiency, there can be prolapse or dropping of the uterus, bladder, and or rectum. There can be urinary incontinence, leaking of urine, and there can sometimes be difficulty with defecation. And for all of these reasons and more, it's important to learn to identify and to know how to contract these muscles. And yes, I am talking about the Kegel exercises. Knowing how helps you to take your vagina from being passive to dynamic. And no, I'm not talking about you need to learn how to shoot out ping pong balls from your vagina. But you should know how to contract these muscles. We, as females, have amazing bodies. We need to appreciate all that we have. And we need to enjoy and learn how to enjoy our health and to maintain our reproductive health for as long as we can. And so I say until the next time, this is Dr. Rahman saying, take care.